Afternoon, everybody. Thank you very much for the invitation. My name is Yemi. I'm a senior manager at healthcare consultancy and data innovation firm CF. We're based down in London. We do most of our work with the NHS, working at local, regional, and national level, but we've also more recently started to do more work with life sciences organizations and digital health providers and investors. And I suppose the reason why I was invited to speak today was we wrote a report. We were commissioned to do some work by the Wellcome Trust and wrote a report that looked specifically at this question: what is the sustainable translation of digital health technologies from academia, which had a global remit. So I'm going to share some of those findings with you today and the recommendations we made. But before I do that, I'm going to just present some analysis that CF have done, which is unpublished, so you guys are the first ones to see it. It basically is showing, we looked at the digital maturity of different integrated care systems across England, and we compared that to a basket of population health outcomes. And what we basically found was that there is for those ICSs that had high digital maturity, they were associated with better population health outcomes. Now, if you believe the data and if you believe the modeling that sits behind this, that represents, if you could improve the digital maturity of the lowest and go to the highest bracket, you would get 9% fewer patients with hypertension, 4% more people with managed type 2 diabetes, and 16% fewer people with coronary heart disease. So this is all to say that our endeavors, our efforts in terms of trying to improve and digitize different parts of the health pathway really can be impactful, right? There is a lot at stake. So as John was alluding to earlier, it's hard work, but we should persevere to do it if and when it is appropriate. So back to the reason why I'm here. We had a research question which was specifically focused on understanding the barriers and opportunities to successful translation of digital health technologies and how this might achieve long-lasting health impacts. The scope of the research was really all academic groups across the globe, so high-income countries and low-middle-income countries. We looked at all different types of DHTs, so from communications tools to predictive models to software as medical devices. And we looked at different routes of translation, so for-profit and not-for-profit. And I should add here that John was an expert as part of this paper, so I'm going to be re-emphasizing some of the points that he's already made, and also trying to bring a little bit of a fresh perspective as well. So we wrote this report. It's set up into 4 chapters. We had a series of focus groups. We had interviews with 38 different stakeholders across the translation pathway. And we disseminated a survey which got 61 different stakeholder responses from across 18 countries. So there's a quite cool basis of evidence here for us to kind of think about what funders should do to support the digital health translation pathway. And I'll just speak to what this pathway looks like. And we've heard a little bit about some of these things today. So you, as a researcher, you're conceiving an idea, you're developing a proof of concept, you're developing that technology, generating evidence, spinning out or licensing, navigating the regulations appropriately, and then providing that real world value. And of course, but this diagram is trying to show that this is not a linear pathway. It's something where you might skip some steps, but then go backwards and then go forwards. But essentially all of these things have to be done regardless of the context in which you're operating in. And we assessed that there are 5 key pathways involved in that really are 5 key factors that influence this pathway. So what is the type of digital health technology that you're using? That might inform the extent to which you have to generate evidence or pass through certain types of regulations. And you might be asking the question there, what problem does the technology that we have solve? The geography, whether we're broadly speaking in a high-income country or a low-middle-income country, so what is the local context? The commercialization route, so how do I generate sustainable revenues? The customers, and really we're talking about here who actually holds the budget. So that spend that's now not going to be spent on X, why would they spend it on Y? And the end user, whether that's a patient or a clinician. And so, for example, how does that fit into existing workflows? And I'll share with you now a summary or a highlight of the report. So you don't have to go and read it, but although you should. But we identified 7 key barriers, and there are 7 key recommendations for grant funders. So the first is academics struggle to find funding for their translation activities, which we've touched upon a little bit today, but I'll go into a little bit more depth. Academics tend to focus on knowledge generation rather than commercialization. So how could funders support an innovation culture? There tends to be poor data collection and poor adherence to standards, and that impairs interoperability and the successful translation of digital health technologies. So how do we support data access standards and data quality across the board? There are some misconceptions around open source, around its commercial viability. So some people think that it creates security risks. Others think that it's not defensible. And some people don't appreciate the cost, but I can go into that in more detail as we go on. And so how do we advocate for open source technology in a sustainable way? Academics have limited knowledge to draw on generally from creating sustainable non-profit organizations, and I'll tell you why that might be beneficial to actually improve that understanding and that capability. There needs to be more understanding of the local context in which we're delivering in, and also there is a digital skills gap that we need to be account for and be aware of. So these were high-level themes. The report was about 100 pages or so, but we've tried to distill it here a little bit. The next slide is, I'll just touch on this briefly. It takes just that one level deeper of the translation pathway. And as you can see, there are loads and loads of things that need to be done before you can successfully translate your tool, right? So it's not just, as John alluded to earlier, doing the research. It's actually a huge process to get your research into making something that has real world value. And at the bottom here, I've tried to indicate what the different types of funding that's available at different stages. And there tends to be quite a bit of funding available at the early phase to do the research, and you can get your grant funding. And at the later phase, in terms of implementation, there are grants available. But we often find it very challenging to translate in that translational step, in that in-between phase, to get that seed or bridge funding, especially for those non-research activities. So developing the technology further, the legal costs, evidence generation costs, and so on and so forth. So we had a recommendation around funders improving that such that we can successfully translate some of these things. I'm just going to share some of the feedback and some of the survey data that we had from academics. And this is obviously broad. It's not every academic that thinks these things, but I don't want to offend anybody here. But commercializing technology for profit is not necessarily a motivating factor for many academics, is what we found in the study. And if they are motivated, they're not sufficiently supported. So this is exemplified by these 2 questions on the left and a series of quotes. On the left-hand side, that's your right-hand, no, your left-hand side, yes. The developers have sufficient support for commercializing their technology, and approximately 60% of people disagreed, essentially, or that they didn't have sufficient support, disagreed or strongly disagreed that they had sufficient support to commercialize their technology. And the same was true for when we asked the question, developers have the knowledge to generate sustainable revenue streams, and the vast majority of academic developers didn't have that. They said that they didn't have that knowledge. I just pulled out some quotes here to illustrate that. Academics tend to have strong convictions about social impact. So they've received money from public bodies, and they think that actually that I shouldn't be generating money for myself as an individual, and it's a common theme that we encountered in our conversations. We talked about academics not necessarily having the skills to commercialize their research and spinning out companies, and John spoke earlier about marketing, sales, and so on and so forth. And academics don't necessarily have the desires or the incentives. So we know that the currency for an academic is publications and grants. And actually, how am I incentivized to roll out something and provide some real world impact if that doesn't progress my academic career? Or what is the risk of me pursuing that and not pursuing my academic career? So how do we create incentives? How do we create commercial models that actually keep academia engaged, but also enables the likelihood of success to increase. I'll go on and talk about open source software, and I think there is a misconception that open source software alone is a precondition to successful translation. What we found from the research was that open source technology can be a really useful tool to build technical capability and human capacity, especially in low and middle income countries. But what's not appreciated is the costs associated with developing that tool and also implementing and maintaining that technology, right? Nevertheless, there are viable business models for open source technology, and there is a case to be made for educating or increasing the knowledge across academia and otherwise about what those successful business models could be. So we came up with a list, and it's a list from our research around what are the preconditions for successful translation of open source platforms. The first is, of course, funding. That the funding can come in a variety of sources, from philanthropic grants to having premium features in your technology, charging for support and maintenance and training and implementation. So there are some viable revenue generating avenues for open source technologies. Next is the community. Now, often there's a misconception that because your technology is open source, that everybody's going to be wanting to build on top of it and write software on it. But actually, that does not tend to be the case. It takes a lot of time and effort and funding for that to happen. And you have to be giving the community something back. What is the community getting in return for them participating in your project? The third is around governance and ownership. So what are the guidelines? What is the best practice around your technology if you have got a community and if they are going to develop on it? And then what are the capabilities of the IT resource and where you're deploying? So these are just some thoughts around open source technology in general. And next, we're going to talk a little bit more about the differences that we observe between high-income countries and low-and-middle-income countries. And I will say that I'm speaking broadly, that not all the high-income countries and low-income countries are exactly the same, but as a point of conducting this analysis, we have to make some generalizations. But of course, there is nuance. What we generally see, and what won't be as a surprise to many of us here who've worked in different contexts and different settings, is that high-income countries have higher market potential. And what do we mean by that? We mean that they have a higher enabling environment, so the infrastructure, connectivity, networks that exist within the leadership and so on and so forth, exist in the countries, tends to be more mature. We also know that there's a higher GDP spend, higher health expenditure per capita, more venture capital investment, tends to be much higher rates of internet penetration, and even cell phone subscriptions and digital skills. And what that practically means is that in high-income countries, there is more of a market for for-profit technologies, right? You're likely to find somebody who's willing to invest, and you're likely to find a customer who has a budget to be able to procure your product. In low and middle-income countries where that environment is less developed, that tends not to be the same market. And this is the reason why we suggest that the non-profit models are more suitable, at the moment at least, in low and middle-income countries. And there are challenges and opportunities for translation across those different environments. But we recommended to the Wellcome Trust and to other funders that strategies should be different, and those different contexts should be considered. Going one step further then, in terms of looking at the kind of the healthcare technology framework that exists within high-income countries and low-middle-income countries, we find that high-income countries, again, because they have a more mature environment, tend to have the enabling factors in place, the hardware and networks in place, the digital infrastructure in place that allows them that leading edge technology innovation to occur in those countries. And this is in contrast to lower middle income countries, where a lot of the innovation around the health technology space is actually happening in the digital infrastructure space. So there's a lot happening, but it's not quite the same type of technologies or innovation that exists. And therefore, we again recommending to funders, how do you actually account for the differences and the different needs of the context that the tools are being deployed and operated in. What is also important here is then, in that case, you need to have strong partners in your lower middle income countries, especially who have an awareness of that local context and have an understanding that can help you to translate your digital health technology in an appropriate way. And the final point to realize here about the difference between low middle income countries and high income countries is, again, it's intuitive, the difference in digital skills in general that represents a significant barrier to successful translation. Again, the lower digital skills are more pronounced in lower middle income countries. And this is, in fact, compounded because those with high level of skills are not incentivized to stay within the public sector, which is a nice way of saying that Google, Microsoft, and others do try and find the best talent in whichever region they're operating within. But what it means is that if we're trying to deploy technology into a healthcare system, into a local government, then we need to make sure that we do so in a way that is sensitive to the fact that the digital skills and analytical capabilities within that place might not be there for a long term. So how do we make sure that knowledge is transferred over a longer period of time? And of course, it's not just unique to low middle income countries. We see it every day in the NHS as well, that we need to improve our digital capability, our core digital capabilities, in order to successfully translate our digital tools. So this leads us to this conclusion that I've kind of been alluding to around commercialization routes for different contexts. So high-income countries, we recommended that there is more opportunity for for-profit spin-outs or licensing directly from academic institutions, given the market maturity and given and because of that, there needs to be that legal and regulatory expertise needs to be sought. We need to think about the best incentives for academics to translate. We need to think about commercialization expertise and how to bring that in as early as possible. And of course, we need good quality and robust data to be able to develop our technologies and evaluate them. And that holds true for low middle income countries as well. But in contrast, because of the more immature market and the developing markets, we saw non-profits as a route to getting your technologies sustainably translated. Here, where there are budget constraints, tends to be even more budget constraints, and the general spend on health technology is lower, you need to have really tight alignment to local strategies and operational priorities. We need to have high degree of user involvement and understanding that local context. If people are in very rural areas or if connectivity is poor, how do you build a system in which devices can work locally or your tool can work locally and not necessarily relying on connectivity? And then, of course, there's a general need for that overall capacity and capability building. And so I'll just present some kind of final reflections from the case studies that we conducted, and also some observations that I've personally had in the industry, working for a few years in the healthcare and health tech industry. So many projects fail due to unclear funding pathways and scale-up costs, and not considering deployment, training, and maintenance. So again, as I mentioned at the top, who are the budgets for the technology that you're developing? And does this align with priorities that they have, whether that be improving outcomes or reducing costs? Even the best technologies fail if they disrupt workflows or they aren't adopted by users. So early on in the process, to what extent are we engaging end users, and how are we making sure that those workflows that we think we're going to embed within are designed in such a way that makes it as easy as possible for the technology to be uptake? We need to understand that different stakeholders have different criteria for success. And so without articulating and demonstrating clear value to the different stakeholders, whether that be cost savings, time efficiency, or health outcomes, depending on the stakeholder you're interacting with, you're going to find blockers to development. And so how can you demonstrate a clear return on investment or other tangible benefits to different stakeholders? there's the realization that a tool that works in a single setting may fail when applied to diverse populations or resource-constrained environments. So what is the infrastructure like in the context you're operating within? What is the technical literacy like in the context you're operating within? What data has your models been trained on, and how does that reflect the population where you're trying to apply it now? How has your technology been built? Is it been built in a modular or customizable way? And finally, without a plan for sustainability, even successfully scaled technologies can fail over time. So, as we've alluded to, how will this product be maintained, updated? How will training be managed? And what are the incentives for the stakeholders that you're selling into to maintain and expand their technology over time? Thank you for listening.